Hello, my name is Julie St. John. I am an associate professor in the School Health Professions in the Office of Research and Innovation, and I am really excited to share a little bit about public health with you all today. And we're going to talk about how and why pharmacists are public health practitioners. So I like to start with showing this picture of my family. Yes, it's true, they do exist. So I have 9 children. Two of my sons are married, and one of them has 2 grandsons. And so this is my family, and I show this for a couple of reasons. One, they really are the reason I do what I do, and that is to really improve community and population health. I want them to have healthy futures. And the second reason I show this picture of my family is that if I can have a full time job and profession with 9 children, I believe anyone can. So just encouragement there if that is your desire in the future. Okay, so if we were in person, we would move around and do some interaction with this activity. But I want you to think about, how has public health impacted you today? Think about when you woke up. What did you do? Did you have breakfast? Did you eat? Did you brush your teeth? And then as you prepared to maybe come to campus or go to a job or something else, maybe you drove there, maybe you were a passenger. How has public health impacted you? So hopefully you all came up with a lot of ways, but a few common ways public health has impacted us is water, right? So we can trust that our water is safe to drink, and those have come from public health interventions. And then also driving, right? So we have speed limits and seat belts and no texting while driving. All of those are related to public health. So public health definitely impacts us, and that's what we're going to talk about today. So we'll go through some basic definitions. What is public health? Really expand our knowledge of that. Kind of the facts on public health's role within the healthcare system, and particularly the overlap and how that works with pharmacy. We'll talk about some public health principles, and then we'll also focus on why public health is important and why you all, as future pharmacists, should be aware of and have knowledge about public health. I hope that this lecture is enjoyable and informative, and I hope you come away with a broader understanding of public health and its connection to pharmacy. And then I hope you're able to apply and share the information and become an advocate and a supporter of public health. So, if we were in person again, I would ask this question and have some cool prizes. But any thoughts about how does public health relate to fall, right? We're in that season of pumpkins and apple cider. And give you a minute to think about that. How does public health relate to fall? Well, and there could be a lot of different things. My mind primarily jumps to food related items, right? So all the pumpkins are being grown, and so you have um, regulations related to anything agriculture, right? To reduce the spread of diseases. So that might just be one way. And then I think of football related to fall, and when you go to watch a football game in a stadium, there's lots of things in place to keep people safe. So maximum capacity size for stadiums. If they're serving food, there's things they have to follow there. They have to have a certain amount of restrooms available for the capacity. So lots of things are related to public health and fall. So how does public health affect us? And we've already thought of some ways, but public health really does impact us in a number of ways. So public health is your health. It is our health, right? How about this? Do you agree with the statement? You're only as healthy as the world you live in. What do you think? My personal opinion, I tend to agree with that. It's hard to be healthy if the world around you or your environment is not healthy. If you live in a home with lead paint or with mold, it's probably going to impact your health. If you live in a city that has been impacted by the recent hurricanes or flooding, your health is going to be impacted, right? Standing water brings all sorts of problems with mosquitoes and other pests. And what about this one? Globalization of health links us all. So how many of y'all have a passport? Probably a lot. I do. And within 24 hours, a number of us could be on the other side of the world. And so um, we've really seen how the globalization has really linked us, and we need to be concerned about things that are going on in other parts of the world. And we've seen this. So I don't know if anyone knows when West Nile virus or where was first discovered. So the name kind of gives it away, right? So West Nile in Egypt in 1939. When did it first come to the U.S.? Anyone know? 1999, New York City. Anyone know when it came to Texas? Now, I'm not sure Texas, but in Abilene, it came to Abilene in 2015. So we can kind of see for that particular virus, it took some time, right? But then what about the more recent viruses? What about Zika? What about Ebola? What about COVID-19, coronavirus, right? Much, much quicker. In a matter of a few months, that came from China to the US. So globalization definitely impacts us. And if there's natural disasters or other types of events, war, civil conflict, that can interrupt food chain supplies, which we get a lot of our imports in the United States from other places. So again, globalization links us all. So why public health? Well, it's moral and smart, and I believe you all have a servant heart, meaning you want to serve others and help others. And so public health is all about that, right? We want to um, be ethical and help all people have equal opportunity and chances to improve their health. And then also, there's a significant shortage of public health workers. In my opinion, that's really important, and it's a reason to make sure that all of our healthcare profession related fields have some knowledge of public health, because I see pharmacists as a huge frontline workforce for public health. And so we'll talk more about that. But there's a shortage of public health workers. There was a surge in the 1960s and 70s with policies, Public Health Service Corps, and so a lot of people kind of moved into public health. But what's happening with that group now? Baby boomers, right? They're retiring. And so it's an estimated that about 20% of the current public health workforce is retiring now, in the either now or in the next few years. And so there's this huge gap there that we need to think about and how we're going to address that. So, what is public health? So, I like this definition from CEA Winslow. And so he says that public health is really that science and art of preventing disease, prolonging life, promoting health and efficiency through organized community efforts for sanitation of the environment, control of community infections, educating individuals, organizing medical and nursing services for early diagnosis and prevention, development of social machinery, which basically creates a standard of living for all. And so I really like his definition. This was in the early 1920s, but it's very applicable today, right? We've seen the impacts of the environment. We have very recently gone through a worldwide epidemic, pandemic. So we can really see how his definition has played out in recent years. And then here's another definition by the Institutes of Medicine, and they really describe public health as all those activities that ensure conditions in which people can be healthy, right? So we want people to be healthy. How do we get them there? So we need to identify threats. We need to try to prevent the threats, and then once they happen, we need to combat them in order to improve the health of the public. So yes, this is one of my cute sons. He'd be mortified because he's 11 now, but I really define public health as anything that has to do with ensuring our basic human needs and rights. So, air, food, safety, shelter, water. Those are basic human rights that internationally we have laws that protect those. And if a country violates those, they can have sanctions against them. So, when you think about public health from this broader definition of anything that has to do with our basic needs and rights as humans, public health can be related to any and everything. So public health focuses on populations rather than individuals. It's not to say that we don't work with individuals, but we're really focused on different groups or populations of people, and how we can improve their health. So this is just a quick snapshot. And again, this is a overview, kind of a broad statement. It doesn't mean that there's not crossover. So when you think about public health versus clinical health, public health focuses more on populations. Clinical health focuses on the individual, right? Unless you're my family, you typically go to the doctor for yourself, right? You go as an individual. Public health is really looking at health And it's that broad definition of disease, of health, right? So it's not just the presence or absence of a disease, but it's really that holistic view of health. So it looks at emotional, spiritual, physical, social, all of those realms that comprise us as human beings. That's what health, public health is looking at, that broad aspect. And clinical health usually is focused on disease, right? Disease and illness. Public health really looks more at prevention and health promotion, so trying to prevent and educate people. Clinical health, again, not to say that there's not prevention that occurs, because there absolutely is, but oftentimes when we go to the doctor, we're looking at them to diagnose us and to treat us. So those are just some differences between the two, and there's absolute crossover, and we need to work together in order to ensure health for populations and individuals. So healthcare and public health synergies again. So there's all these things that kind of cross over and work together. So public health can help improve healthcare services through coordinating efforts. It can improve access to care by establishing frameworks to provide care for the uninsured. So there's a lot of public health programs, so indigent care programs. The Affordable Care Act, right? That was a policy initiative to try to expand insurance coverage, right? Trying to get people access to healthcare. Improving quality and cost effectiveness of care by using a population lens or perspective, using clinical practice to identify and address community health problems. So clinics, medical clinics are often the first line of finding problems, right? So if someone goes in and they have lots of maybe gastrointestinal issues, and so then they go down their checklist if they test for things, right? And then what if they discover I'm trying to think of a quick E. coli, right? So maybe the person has E. coli. Well, then that is a reportable condition. We're going to talk more about that. But then they notify public health, and then public health starts to figure out, okay, they have to talk with that person, figure out where they ate, where they did all these things, so where they got that exposure, and then try to mitigate those effects, lessen those effects, right? Because that person is sick, then probably others are. And so that's kind of that connection where clinical practice often identifies these public health threats. We can strengthen health promotion and health protection by mobilizing community campaigns. And we can also shape the direction of the health system by collaborating on policy and training and research. So I like to show this picture because it's just a nice way to think about how all of these aspects can impact our health and result in illness and injury. So hopefully all of us can kind of see the connection. Why do we care about civil conflicts? Well, for lots of reasons, but in terms of our health, what happens in civil conflict? Well, that's easy, right? Not only can you get physically harmed, right? Um, but there's also civil conflict can destroy food supplies and water supplies and infrastructure, electricity, and all sorts of things. Same thing with natural disasters, and we're seeing that now with the different hurricanes. Um, excuse me. Excuse me. So all of these things, we've talked about how the environment, if there's a drought in one place, it has these impacts down the road for other populations, food supply chains. Um, Civil conflict can result in displacing people, right? As can natural disasters and disease transmission. So just like to show this slide because when these things happen, they can result in illness and injury, and that's where public health really steps in to try to help um, navigate and reduce the harmful impacts. Okay, so what is the mission of public health? So we are really trying to fulfill society's interest in assuring these conditions in which people can be healthy. And why society? Because that's who we are. It's that big picture, right? Seeing the forest for the trees, right? The kind of that idea. But mission of public health, we want to ensure conditions which people can be healthy. And it goes back to the moral and smart part of public health. The vision for public health, healthy people, healthy community. Simple, right? That is what we strive for in public health. A society, and so if you look at the Healthy People 2030 website, their vision, a society in which all people can achieve their full potential for health and well-being across the lifespan, right? So again, that broad definition of health, not just disease, but all of those aspects, well-being across the lifespan. And then mission, promoting, strengthening, evaluating the nation's efforts to improve the health and well-being of all people. what are the core functions of public health? So there are three essential functions. And if you hear of someone that says in their public health and does not know these, um, they may not be in public health or they need some more training because these are absolutely critical to public health. So, assessment. What do we mean by assessment? It's collecting data, assembling data, analyzing, distributing information. So, assessment is figuring out what's going on, right? In all sorts of different aspects, but what's going on, assessment. Assurance is looking at access to health and healthcare services, right? So, and it's not just access, but we want to ensure access for all people to quality healthcare services. And then policy development, that's probably one of the easiest ones to wrap our head around, but developing healthy laws, and we could probably list several examples very quickly, right? So, no smoking, um, laws and the T121 law that passed in Texas several years back, right, that raised the tobacco age, including all tobacco products, vaping, cigarettes, all of that to the age of 21. So policy, healthy laws, well, laws that help us to be healthy. Okay, and then within those three core functions, there are some essential services that are provided, and you can kind of see it's this wheel of where uh, assessment, policy development, insurance are occurring, and then there's different services that occur to ensure those functions. And I'm not going to go in deep detail, but this is something that's very common, and what the health departments seek to become accredited, these are aspects that they have to make sure they're doing all of these things. What are the fundamental purposes of public health? Let's think about that a moment. What do you think are those fundamental services or of purposes of public health? Well, we want to prevent epidemics and the spread of disease, so that's absolutely fundamental. We want to protect against environmental hazards. We want to prevent injuries. We want to promote and encourage healthy behaviors, which, in my opinion, is one of the harder things to do, right? And that's actually that's my field. What I focus on is behavior change. People generally know what's healthy, uh, but we don't always do that, and there's lots of reasons. And so we're trying to figure out ways to encourage and promote healthy behaviors, responding to disasters and assisting communities in recovery, and then also just assuring quality and accessibility of services. These are really the fundamental purposes of public health. So let's talk a little bit about history. So we know that even way back in history, if you look in the Old Testament or contemporary literature at the time, so thousands of years ago, there were health codes and laws. So if you read in the book of Leviticus, and again, it's also in contemporary literature, they had all these laws about, okay, if someone has a white spot, then they have to be outside, away from everyone else. And if someone touched the garment, that touched the person, so there were all these, quarantine and all these ideas of laws. And they didn't understand necessarily the nature of the disease, but they understood quarantine and the need for that. So there were laws from long time ago understanding some needs to prevent the spread of infection. And then Percival Pott, one of my favorite fellows. So this is a really interesting story. So he's considered the father of occupational medicine. Um, so he discovered a particular type of cancer in chimney sweeps. Anyone know what it was? So think about in 1775, chimney sweeps. So they had everyone had chimneys there. That was their primary source of heat and cooking and all sorts of things. So, but chimneys are really dirty and really sooty, right? Lots of soot. So chimney sweeps would take their clothes off, right, and they would clean the chimneys in the nude because they didn't. Back then they didn't take baths every day and they did not have lots of sets of clothes like we do today. But they would clean in the nude. Well, what's getting on them? The soot. Well, what's in soot? Carcinogens. So they were getting dirty, putting their clothes on top of them, and they didn't bathe every day and they didn't wash their clothes. And so he discovered that and the chimney sweeps, there was this common type of disease, and it was testicular cancer. Interesting, right? And that kind of makes sense. Exposure to carcinogens, a very sensitive area of our body. So that's Percival Pott. And then, of course, John Snow, the famous John Snow, the father of epidemiology, cholera, and then in 1854s in England, right, the famous pump handle situation. So What did people think about cholera prior to Johnson's discovery? Well, they kind of had this theory that it was some sort of mystic miasmas, this bubbles, that kind of floated around, or it was, it was very interesting theories that they had. Well, Jon Snow was very practical. So what did he do? He got a map, he plopped it down, and he started mapping out all the cases of cholera. And he was able to trace that down a particular water line and trace it back to this pump where this was occurring. And then you have polio vaccine discoveries, two different ones there in the 1950s, which I always think, wow, that really wasn't that long ago. I don't know if you all know of anyone, but I know people who had polio and were impacted by that. So really had in the 1900s a lot of the vaccines coming, being discovered, and we're continuing today to get more and more vaccines. And then the eradication of polio was huge, and that happened in 1979. It has not happened worldwide. We've gotten very close several times, and then different things happen that kind of cause a resurgence of polio. And then we had the eradication of smallpox worldwide in 1979. And so, and that's a current, thought that it's been eradicated. However, with bioterrorism weapons, that's one of the diseases people are really worried about. And so there are stockpiles of vaccines in different places across the U.S. In the event that there was a bioterrorism event. So that's some of the history. And then kind of in the early 20th century, there's a supportive relationship prior to the 20th century. So there was kind of, there was an understanding of public health, but it was mostly focused on the medical field. And then once there was this period of professionalism and practice transformation, which was spurred by the emergence of bacteriology. So that happened, and then there was an acceleration of functional separation. So it was kind of like there's a supportive relationship, and then there's kind of this practice transformation, like better understanding of public health and starting to specialist in the medical field related to public health. But then really after World War II, there's started to see, okay, public health is public health, and medicine, they connect, but there's this, healthcare, there's a distinction between the roles and functions of each. And so that really happened after World War II, and you had the establishment of the Public Health Service Corps and lots of infrastructure investment in public health after World War II. And then we had this brave new world of managed care and cost emphasis in the 1980s and 90s. And then after 9/11, we had this whole new understanding of public health, right? And I think that's also, you could say that again, maybe post COVID-19 pandemic, it's really kind of opened our eyes again to all the different types of threats to the public's health, and their biological, their environmental, and then their man-made threats. So that's kind of how public health has evolved and got us to where we are today. So just what are some of those highlights of public health? So if you look at the 20th century, we've already talked about vaccinations, well, safer workplaces. In the 1800s, you would hear about massive fires in industries and hundreds of people would die. Well, we now have OSHA, things in place to make sure that our workers are safe and healthy. We have safer and healthier foods. I don't know about you all, but I'm very thankful that when I go to a restaurant, I can feel confident that it's been inspected and it has to meet a minimum standard. Motor vehicle safety has been huge. So in the 1980s, there were states that were passing seatbelt laws. How did they get states to do that? Anyone know? The federal government. How they encouraged states to pass seatbelt safety laws? Money, right? Money is a motivator in a lot of things. So they tied funding for road repair and transportation for states to seatbelt laws. So, and that's often how the federal government impacts policies across the board, right? They often will tie money to it. Lots of systems do that. They do it in education as well. So, motor vehicle safety, though, once seatbelt laws were passed in the 1980s, traffic fatalities reduced by half. Yeah. And then we started to see a resurgence in the number of deaths in motor vehicles in the early 2000s. Well, what was going on in the early 2000s? Cell phones. Everyone had cell phones, right? So we were seeing lots of vehicle-related deaths to texting, and so then policies were impacted, were enacted to kind of combat that. Other things that happened in the 20th century, 1900s, we started to be able to control infectious diseases better. So we understood the spread of infections better, things like washing our hands and um, Clorox and, all these things about sanitizing. We also had a decline in deaths from coronary heart disease. There's a big push in the 1980s, right? Like, don't eat 5 Big Macs, right? Like, that can lead us to be not so healthy. And with that push, it really did reduce the number of deaths, but heart disease is still the #1 killer worldwide, regardless of whether a country is developing or further established. So across the board, with countries, lots of resources, not so many resources, heart disease is the #1 killer. Why is it important? Because it's preventable to a large degree. We'll talk more about that. Family planning, we've seen a lot of things come up with that. And then healthier mothers and babies, that's been a focus. And interestingly enough, though, it's still a major issue. How is it that in 2024 we still have mamas and babies dying to the extent that we do, right? And we've seen some spikes in those. And so it's one of the main focuses of the Texas Department of State Health Services, Health and Human Services in Texas right now. It's their #1 priority is to get a handle on improving maternal health and child health. And then fluoridation in drinking water is just another example. Fluoride reduces cavities and a lot of other helps in other ways, and so that was another public health achievement. So in the 20th century, we had an increase of life expectancy. When in 1900 it was about 47 years, to 2000 it was about 77. 2018 that should be updated because it's still about 78 years. But it's starting to decline a little bit. Now we saw that decline some during COVID-19 pandemic, right? A lot of people died, and that kind of impacted life expectancy. But historically, when you look at life expectancy, rural areas had better health. And why might that be? Well, lots of reasons, right? They're probably more active. They might have had more access to fresh fruits and vegetables. But now, about 5 years ago, we saw that shift where rural people have less life expectancy, and that's concerning. Well, they don't have as much access to healthcare services. So, something to think about. Why is this important? Okay, so we just learned that you had life expectancy of 30-year increases, right, in the 20th century, and we just talked about all those things that happened in the 20th century related to public health. How much of our healthcare spending as a nation do you think goes towards public health? Prevention. So of all of our money set aside for healthcare as a federal government, less than 5% goes to public health. That 30-year improvement in life expectancy, what percent of that was due to public health initiatives versus healthcare procedures or medical procedures? 95% of that 30-year life increase in life expectancy was due to public health prevention and interventions. Something to think about, right? So much of our life expectancy increase is due to public health, yet we spend less than 5% of our healthcare budget on prevention. So just something to think about. If we were to improve and cure every type of cancer, how many years would life expectancy go up? What do y'all think? So 4 to 6 years. If we cured every single type of cancer, life expectancy would go up an average of 4 to 6 years. And please don't hear me say I don't want to cure cancer. I want to cure cancer. I want my colleagues who are brilliant at the other schools and departments to take on that fight, right? So absolutely important to cure cancer. Yes. 4 to 6 year life expectancy. If we were to cure heart disease, which is largely preventable, right, by factors, how many years would life expectancy increase? 20 years. So just something to think about. We spend a lot of our healthcare money on research and curing particular diseases and procedures, which is needed, absolutely needed. But if we spent more money on prevention, for example, preventing heart disease, we would have our life expectancy see a greater increase. So just food for thought. So policy, rules, and regulations. So we already talked a little bit about this, but the more recent one, fresh in our minds, we had face mask and isolation and all these things 6 feet apart. Speed limits are examples, seatbelt laws, smoking ordinances, insurance policies, substance abuse laws, right, with things that we are illegal that we cannot do, cell phone usage laws, school and nutrition, physical activity. So lots of policies have been enacted to, again, it's one of those 3 core functions of public health policy development, but lots of things that have been put in place to help us be healthier and to protect us. So top 10 causes of death in 2019, it's not really changed much. I showed so COVID-19, so for about 40 years, the top 10 causes have stayed the same. When COVID happened, that of course was in the top ones. It's still there, but it's not in the top 3 for sure, and in the 23 data. But what do you see that's common? Heart disease, cancer, COVID, accident, stroke, respiratory diseases, diabetes, chronic liver disease, cirrhosis, nephritis. What do you see that's common across those? What do you all think as pharmacists, future pharmacists? What's common about those? So a majority of those are preventable by our behaviors or associated with behaviors, right? So, and those 3 the causes of death are related primarily to 3 behaviors. So tobacco use, poor diet or lack of exercise, and then a moderate use of alcohol, right? So those are behaviors that people have control over that they choose to do or not do that impacts their health. And so a lot of those top 10 causes of death are preventable by our behaviors, which I know you all know, but that's what public health is really trying to focus on. So just lots of health threats. No shortage of those. I thought this one was interesting. So listeria. So if you Google CDC health threats and it will update, but there's all sorts of things that they'll put out there. I also there's all sorts of outbreaks, but we had one in listeria in meats in July. This one, salmonella outbreaks in pet bearded dragons. Hedgehogs are also really common. Outbreak of salmonella. So these are just a few that I listed. Of course, we had monkeypox, so COVID-19, lung injury for e-cigarette use that kind of came to the fore in August of 2019. We've had lots of different measles outbreaks. And people tend to think, oh, measles, it's not a big deal, but people can die from measles, and so severe forms of it. And then we've had all these hurricanes, the current one that's happening now. We had Helene just a couple weeks ago, and then there are some other big ones I listed there. But there's an opioid epidemic where people are dying from overdoses, more common in rural areas, right? The Ebola outbreak, H1N1. And then of course 9/11 was also a major public health threat. So no shortage of public health threats, and these are the things that public health are trying to prevent, and then if they happen, to mitigate those as quickly and safely as possible. So who's responsible for public health? So there are state and local health departments that primarily have the responsibility for health, right? So you have the state and the District of Columbia health department. So there's state health departments. So there's 51. And you also have the Indian Health Service system. So they have tribal health departments. That's kind of their own bucket, their own little barrel there. You have local health departments, so approximately 2,500. That number fluctuates some. Interesting fact, though, there hasn't been a new health department established in Texas in over 50 years, right? Most of them are consolidating, but there's lots of areas in Texas that do not have local health departments. They rely on the state health department. And then you have territorial health departments and regions. So the formal government structure in the United States. So you have the federal government, which regulates commerce funding and national security. So they have those, broad responsibilities. And then the state government, though, has primary responsibility for public health. And then local governments, local entities in public health have authority is delegated by the state. So that's kind of how that works. Big picture snapshot. So you have the Department of Health and Human Services. Of course, that's headed by the Secretary of Health and Human Services. It's appointed by the President and a member of the Cabinet. And approximately 25% of our federal budget, which is the largest department in the federal government, is goes to the Department of Health and Human Services. New healthcare reform law provides a series of new duties and responsibilities for the health service system. There's a law that happened. It organized Health and Human Services into 11 operating agency and 10 regional offices. So I believe Texas is in Region 6 on the federal level. We were in there with New Mexico, Arkansas, Oklahoma, and I think one other state. So sorry, it's slipping my mind at the moment, but we have regional offices for Health and Human Services. So all 50 states and the District of Columbia have their own state health department. And really, the purpose of the state health departments, again, we want to promote, protect, and maintain the health and welfare of citizens. Oftentimes, they're headed by a medical director, so usually a physician, who is appointed by the governor, right? So, and then the purposes are represented in those core functions. Remember that wheel where we had, the three core functions with the 10 essential services. That's really what those health, the state health departments are responsible for doing. Okay, then you have local health departments, and those can look different depending on each area, right? So it can be the responsibility of city or county governments or both. So in Abilene, we have the Abilene-Taylor County Public Health District. So they work together as a city and a county, and the jurisdiction often depends on the size of population, right? So if you are from Harris County, so Harris County Health Department, but then you also have Houston City of Health Department, right? So, and that's really common in larger cities. So there are particular services that are state mandated that they are responsible for. So inspecting restaurants, right? Food safety, public building inspections, public transportation inspections, detection and reporting of certain diseases, right? So local health departments get the call from local healthcare providers about any of the mandatory reportable diseases. It goes to the local health department, which then it goes up the chain to the state health department and then to the federal, to the Center for Disease Control and Prevention, the CDC, as applicable needed. So, and again, it's anywhere from 2,500 to 2,800 local health departments. That number kind of fluctuates. And then again, we've talked about these notifiable reportable conditions. You might have seen a list similar to the one there. Hopefully you have, because it's important for you all in your line of work to know these. And so there's a couple of websites there where you can go find more information. But there are certain illnesses, diseases, infectious diseases, right, that people have to report. And then the health department has the responsibility to follow up on. So what's the organizational framework of public health? So kind of think of it as a pyramid. So we've already said that, really locally has the primary responsibility of keeping people safe. So you have organizations, whether that's nonprofits, you have media, you have that bottom level of all of these people that are working to keep people safe and to improve health from multiple aspects, right? And then in the middle, you have your government agencies, other than public health, that are also involved. You have state, tribal, local, territorial health departments. So an example of other government agencies for environmental health, for example, it's related to public health, so it's separate, but it also has crossover and implications. The Department of Transportation, that also has implications. So those other government agencies, then specific health-related agencies, and then your clinical care delivery system. So those are kind of like at the middle level, and then again, the federal agencies are at the top. World Health Organization, so been around a long time. It's the most widely recognized international government health-related organization, right? So it's headquartered in Geneva, Switzerland. It has 6 regional offices around the globe. It's not the oldest, but it is World Health-related international agency, but it is the largest. And so it was kind of 45 and 48 were pivotal moments in the creation and establishment of that. This number changes a little bit, but approximately 194 member countries, and you can lose your affiliation. So at the end of President Trump's presidency, we had withdrawn from the World Health, or we had, made that movement because of a decision that didn't align with policies or something. But again, countries have the ability to meet certain standards or criteria, and they'll become part of that, or they can also be what's the word? where they're no longer affiliated if they don't meet certain standards. So, but the World Health Organization is a very large public health organization, and it's important for the health of all people globally and the work that they do. So now let's talk about what are the careers and disciplines of public health. So there's kind of five primary categories of public health or areas of disciplines in public health. So biostatistics, environmental health and occupational health, epidemiology, health policy and management, and then again, social and behavioral health. So for each of those, I think those are pretty self-explanatory, but for each of those, there are other disciplines that are related, right? So you have the kind of the behavioral sciences, and that can be sociology, social work, psychology, anthropology, economics, political science, communication. So all of those fields are kind of wrapped into social and behavioral sciences. Then you also have life and physical sciences, biology, chemistry, physics, environmental, all of those, agriculture, biomedical, kinesiology, nutrition, family, consumer science. Those are kind of wrapped into life and physical sciences, which are absolutely related to public health. And then healthcare is a part of public health, so medicine, nursing, pharmacy, physical therapy, and all those other wraparound services. Business and law is also law has a lot to do with that healthy policy development. And then architecture and engineering are also very important to public health. So, for example, older buildings, where are the elevators? Usually right at the front of the building, right? If you've ever noticed that in older buildings, they'll be right front and center. Well, newer buildings now will often have these beautiful staircases that people can take. So encouraging people to take the stairs. And so if someone's building a neighborhood, now we have these. There's very nice neighborhoods with walking and running trails and uh, parks, right, built into the community. So those sorts of things are really important to architect and engineering that are related to public health. So again, we had those. And go back a slide to, well, maybe I can't go back a slide, but those five big key disciplines. But then within that, there's all these other disciplines that are also related to public health. So I do want to talk just briefly. TTUHSC does have a School of Population Public Health with a Master's of Public Health program. And there is a PharmD and PH dual degree program. So if y'all have interest in that, you can reach out and I'll have that information posted. But it's what's called a generalist. That just means that you take all the core required classes and then you can take electives that are kind of focused more of your area of interest. It's a 45 credit hour degree. There's 9 required classes and then 4 electives. And there's also an applied practice experience and an integrated learning experience or a capstone course. And then how that works is so we accept 9 hours from your pharmacy degree program into the MPH program. So if y'all have interest of that, I'll share the contact information. So I just listed some resources related to public health that might, if you have further, interest and want to explore more. And then I have some resources very specific to pharmacy and public health. And so I really encourage y'all to look at. So in the National Public Health Service Corps, pharmacists can be a part of that because pharmacists are very much considered frontline workers in public health. And then there's some additional ones. If you have any questions, since this is a recorded lecture, feel free to reach out to me. I'm in the Office of Research and Innovation with the School of Health Professions. So I have an office in the School of Pharmacy on the Abilene campus. You see my email there, but if you just search my name, Julie St. John, feel free to reach out to me and be glad to answer any questions and be of assistance. And then if you are interested in the MPH program, you can contact Patrick Lloyd or Corey Patterson for additional information about that. So thank you so much for your time and attention today. I hope you learned more about public health. And so here's the take-home message. Pharmacists are frontline public health workers. Why? Because oftentimes pharmacists, whether it's clinical settings or in a community setting, people go to the pharmacy when they may not go to a doctor, right? Sometimes they're coming to pick up prescriptions, but oftentimes they will come in there for other reasons. And so you all can give shots and vaccinations and other things related to medicine, and you have a huge opportunity to educate and help inform your patients and clients that walk in off the street, and you have that ability to impact public health. So you are frontline workers. You will be in your profession. I thank you for your interest in choosing to come to TTUHSC in this program. So wish you the best in your future. Thank you.